My name is Taylor Averett, and I am speaking specifically to two of the senators from my state of Utah, Mike Lee and Orrin Hatch. But I'm also speaking more generally to the entire Senate and to all of the representatives of all of the constituencies here in the United States. Yesterday, the draft for the bill, the Better Care Reconciliation Act, was released, and to say the least, it poses many dire concerns, extremely dire concerns. It not only takes some of the worst aspects of the American Health Care Act that the House passed in May and makes them worse, but it also takes several aspects of the Affordable Care Act and makes them worse. I feel like this draft, if it were passed into legislation, is cruel. I feel like this draft and the implications that it holds is extremely punishing to millions upon millions of Americans, myself included. I feel like the reasoning for this is completely un-American. First and foremost, I'm reading from some notes that I've prepared, a statement that I've prepared that I want to share specifically with my senators, Mike Lee and Orrin Hatch. Specifically, my concerns include that cutting Medicaid expansion would remove health care for millions of people who desperately need it. The provisions of this draft include that by the year 2025, over 11 million Americans will lose all of their Medicaid coverage, and that starting in that year, the growth rate for Medicaid will not adequately meet the expected rise in healthcare costs, meaning that year by year, slowly Medicaid will become less and less effective. As a person who has worked with many people who have used Medicaid, Medicaid already has several flaws. To make it further flawed is cruel. It is completely nonsensical, and it does not do these Americans any justice. Tax subsidies will be reduced to help the poorest Americans, which will inevitably mean that their health care is going to become more expensive. Removing a standard of essential health benefits that was part of the Affordable Care Act would allow states to pick and choose what they feel is essential. This invites the dire problem of people who have certain life or death situations or conditions to possibly forego having health care, forego having any kind of procedures done. In the past, that led to tens of thousands of Americans dying simply because they chose not to go to the doctor when they needed to. They chose to take care of things themselves, which further complicated matters. It led to many problems for many tens of thousands of Americans every single year. And essentially, removing a stipulation such as essential benefits invites that to happen all over again. Removing the individual and employer mandate removes one of the biggest factors that made the Affordable Care Act affordable. In that healthy people, young people specifically, who typically are going to have low costs to a health insurance company, they would be lumped into the same pool as people who have higher costs, people who have chronic conditions, people who are older, people who need more care. Now, the idea behind insurance, all insurance, car insurance, homeowners insurance, any kind of insurance you want, is that you put a huge group of people with the idea that some people are going to incur costs while the majority of those people don't. That is how health insurance, that is how any insurance business makes money. That is how they stay profitable. by having a larger group of people who don't incur costs in the same group of people who do incur costs. Now, removing the individual mandate, removing the employer mandate, removing the mandate that people have insurance means that the only people who are going to try to get health insurance are going to be sick people. If you only have a pool of people who incur costs, the premiums for those people is going to be astronomically high. Okay? It goes against the very rationale of insurance, any kind of insurance. If you're only going to offer automobile insurance to people who are going to get into car accidents, the premiums for the automobile insurance are going to be high. If you only offer homeowners insurance to people who live in the pathway of a volcano or from people who live in the pathway of hurricanes, homeowners insurance premiums are going to be extremely high. It is no different with healthcare insurance. Cutting taxes on several things, including cutting capital gains taxes, taxes for the wealthiest Americans, taxes for health insurance companies, taxes for pharmaceutical and medical device companies. All of this gives these groups of people or these individuals who do not need tax cuts. All of this gives a tax break to people who already are profiting in immense ways. The healthcare industry is one of the largest industries in this country. It is one of the wealthiest industries in this country. It does not need a tax break. They are doing well. They're just fine. The wealthiest Americans are doing just fine. There is no reason to give a tax break for these people, and it further complicates the issue of trying to make healthcare more affordable. One of the reasons why those taxes were included was to make the Affordable Care Act more affordable. And what you're doing is you are gutting provisions that make healthcare affordable under the Affordable Care Act. All of this, I want to remind you, goes against what two leaders in your political party, President Donald Trump and Senate Majority Leader Mitch McConnell, have complained about the Affordable Care Act. On the campaign trail, President Trump repeatedly complained about the Affordable Care Act, and he said he would make healthcare affordable for all Americans, including giving universal coverage. He said that in several interviews on television. Just a few months ago, before the inauguration, Mitch McConnell went on television and complained about the Affordable Care Act, specifying that it doesn't insure a sufficient amount of Americans, specifically 25 million Americans who are still uninsured, that co-payments were increased under the Affordable Care Act, and deductibles were increased. Essentially, the Affordable Care Act failed to insure all Americans, and that for the people who did get insurance for the first time, it became so cost prohibitive that they weren't even able to use the health insurance that they had for the first time. Now, all of this is a valid criticism of the Affordable Care Act. I agree, which is why, based on the dismal and cruel provisions of the American Health Care Act and the Better Care Reconciliation Act, and also based on the dismal performance of the Affordable Care Act, this is why we need to move to a universal healthcare system for the first time in America. We need to have universal healthcare for all Americans, guaranteed by law. We are living in a time period when the United Nations is encouraging all countries, whether they are rich or whether they are poor, to have universal health care. And to live at that time and to have the wealthiest nation on earth, the United States, not be seriously discussing this and trying to implement this in the Capitol building and in the White House is absolutely insane. It is absolutely absurd that we are not moving towards universal health care at a time when the rest of the world is. And quite frankly, when most of the industrial world has already had universal health care for several decades now, and it has provided a high standard of health care in those countries and a low cost. Not only for most of these industrial countries, not only is healthcare less expensive per person, but it is also less expensive as a ratio to the GDP of those nations. And the exact opposite is true in the United States. We, as the wealthiest country in the world, pay more for healthcare than any other country on earth. There is no reason for this. It is completely insane to have as much money as we do and to be starving our citizens for every nickel and dime because of healthcare. It is insane. It is like trying to bash your head against a brick wall and expecting it to move. And what you're proposing is to return to a system where that brick wall is reinforced, making it even harder. The Affordable Care Act tried to remove some of the barriers of that brick wall. And essentially what you're trying to do is to make that brick wall thicker, stronger, and harder to break through. It is time to remove the brick wall. It is time to have universal health care for all Americans. It is cheaper on the whole for most of the industrial countries of the world, and for some of the developing countries of the world. It provides better healthcare factors, and those citizens enjoy healthier lives than most Americans. We have mediocre healthcare at best, and we are ranked far below all of the industrial countries, and including some developing countries, in terms of how healthy we are as Americans. And yet we pay through the nose for it. And what you're proposing is that not only we pay through the nose, but that we give an arm and a leg for it as well. It is cruel, it is inhuman, and it is completely absurd in all aspects. I urge you to press forward legislation that would finally give us universal health care for all Americans. Thank you.